So, yes, British Columbia, we have the dubious distinction of the highest percentage of oldest farmers in Canada and the lowest percentage of youngest farmers in Canada. So what are we going to do about that? That's not a sustainable mechanism. We need to address that. About 2 years ago, I heard that we were building a new hospital in the Comox Valley, in Campbell River. The next hospital after we've got those built is going to be in the Cowichan Valley. And I asked a crazy question. What is it going to take to get a local potato into that hospital? How are we going to do that? I thought that would be quite easy. So we're building 2 new hospitals in the middle of an agricultural community that's known for root crops. We can do this. This set me on a journey. And it's complex, as I've learned. Island Health, Comox Valley Regional District, and the McConnell Foundation are behind the work. And it's part Feed Comox Valley, and FEED stands for Food, Environment, and Economic Development. Part of an 8-project national initiative. So we have 2 post-secondary institutions, North Island College and Concordia University, 2 school boards, and some healthcare. First thing I want to say is, I come at this from a business perspective. That's my background. And what I've realized in food is you get a lot of people around a table, and some people are talking about even urban gardening, and some people are talking about farmers markets and CSAs, and some people are talking about retail. And my suggestion is that you decide which segment you're in and have that conversation. So although we're trying to break down silos, from a marketing perspective, it's really important that you understand your market and you're very deliberate about who your customer is. These first 3 here is pretty much, this is what I've grown, would you like to buy it? Then you get into the institutional direct relationships, which I'm very passionate about. Over here, it's, this is what I want, grow it for me. Those are very different systems. And at some point, if you want to go beyond the farmer's market and start looking for scale, you're going to have to change from, this is what I've grown, will you buy it, to what do my customers want, and how do they want it packed, and how much of it do they want. It's a very different way of doing business. So here's what I've learned. We talk about retail and we talk about farmers markets. The growth in farmers markets, which is fantastic. But to go from here to here with nothing in between, it's too big. It's much too big a leap. Very different food systems and a very, very big leap. Luckily, in the middle, we have a taxpayer-funded food system. But we don't talk about this one. We somehow don't get BCAFM talking to the Ministry of Health and saying Ministry of Health is the largest single buyer of food, institutional food, in BC. How about buying some BC food? That's the conversation that we need to start having. I told you it was radical, crazy stuff that I'm going to talk about. This is called social public procurement. And I learned all about this in my work at the Olympic Games. The Vancouver Olympics was the first Olympic Games ever to add social into its sustainability strategy. So before that, sustainability was green, it was environmental. The Vancouver Olympics added social considerations, and we learned a lot. So I'm a big advocate for moving from the environmental movement, which has done a very, very good job over the last 30 years of changing our behavior. Let's move beyond do no harm in our purchasing and actually move to doing some good. That's what social public procurement is all about. And it's about levering tax dollars that we're spending anyway to have better social outcomes. Because they don't really get a lot of support for higher taxes. Let's leverage the ones we're spending anyway for better social outcomes. So North Island College, I started with North Island College. We had to change a lot of policies. And my very first conversation with the president, when I said, can we get local food served in this college, he said, you're not going to do anything illegal, are you, Sandra? So I said, no, the perception with compliant, risk-adverse public sector procurement officers, the perception is that you say local and it's contravenes trade agreements and it can't be done, it's absolutely illegal. That is the perception. Don't let anybody tell you that that is fact. It is not fact. So, first of all, you've got to overcome the perceptions. So then I went to talk to the VP Finance at North Island College and got the usual objections. We can't do this because of trade agreements. I carry trade agreements with me at all times. I asked them to point out which part of the trade agreement is it that's stopping you doing this. They can't do that. Okay, so it's perception that we have to overcome. November the 5th, last year, it was a very exciting day for me. We went to Seafoot's farm market in Comox. We picked up locally grown carrots, delivered them to Vancouver Island Farm Products, that's Jamie, who's delivering them to Dawn McRae, who's a locally owned company. 3 locally owned companies, and they took it to North Island College. It was the first time that a farm direct carrot had been delivered into North Island College. Thank you, the support's nice. So if we can do it at one college in the Comox Valley, what's going on around in the rest of the world? Well, there's 10 family farms supplying the San Francisco Medical Center. So they've got together, exactly as Ozina was saying, and that's the next step. So first of all, you demonstrate to the bureaucrats that it can be done. Next, you actually get into aggregation and start working together. The beautiful thing about institutional demand is it is secure. Hospitals are on a 4-week menu cycle. They do exactly the same thing every 4 weeks. So you can predict the volumes, you can predict exactly what they need. What if we just matched small-scale farm to a hospital and they could sit down at the beginning of the year and say, can you grow to order for me? When you take the multinational companies out of the supply chain, we actually don't have a price problem. That is a perception put out there, possibly by the multinational companies. So that is really, really important, that if you can get your head around higher volume, smaller margin, you're not going to get farmers market prices. But can it be your anchor contract that gets you the scale that you need to move up to the next level? It might be. So Britain's doing this. Britain's way ahead of us. I work in social enterprise and social innovation, and Britain's probably 15 years ahead. I learned most of what I learned from the UK. It took a farmer in the position of Minister of Agriculture there and say, now that I'm the Minister of Agriculture, we're going to buy British food first, and our farmers are going to get a fair crack at the business. Getting a fair crack at the business actually means getting out of group purchasing contracts, which force everybody down the institutional supply chain. So as advocates and British Columbians, that's what you want to be advocating for in government.
Advocating for what? Say it again.
Getting out of group purchasing contracts.
And farmers in government.
And farmers in government, how about that? Yeah. Brazil. So Brazil, by law, requires 30% of the food purchased must come from small family farms. If the federal government's buying it, it must come from small family farms. $337 million annually goes to 130,000 small-scale family farms. Aramark. Aramark is, there's only 3 companies that really feed Canada. 3 big food service management companies. Compass International, Aramark, and Sodexo. I work with Sodexo at the Vancouver Games. And by the way, at the Olympics, when we said to them, we want local first, is it going to cost us more money? And they said, no, we can do it if we have to. We don't ask. You can't blame the multinational companies for not buying local if the government's not asking, if we, the taxpayers, not actually asking them. Now, if we ask them, I can tell you they're very good at responding to customer needs. They're very, very good at responding. So it starts by asking. Aramark is the company that supplies the South Island hospitals. We have a very different relationship with food service on the South Island than we do north of the Malahide. So on the South Island, most of the food is being supplied by Aramark. And I met with Island Health in Victoria, and I met with Aramark. And they said, we can't do this. Nobody's asking us to do this, Sandra. You're the only one talking about this. Nobody else is asking us to do it. So it's interesting that you say you can't do it, because you're doing it in Ireland. We are. So they can do it, if they're asked. We're not asking. Denmark. Government of Denmark this week announced that in their hospitals, they're going 60% organic. 60! So Denmark wants to lead the Western world in organic farming. And that's an aggressive target, but that's by 2020. They want to double the amount of land in organic production between 2007 and 2020. And how are they going to do it? They've realized that their hospitals, their institutional demand, is how they can demonstrate the leadership and provide security of demand to make that kind of change. Why are we not using our taxpayer dollars and getting the Ministry of Agriculture to walk across the hall and talk to the Ministry of Health? And he left before I started talking. And Concordia is part of this national project that North Island College is a part of. And last week, they put out an RFP. Does everybody know what an RFP is?
Yeah.
So, a request for proposals. This is how the major food systems work, is it starts with a request for proposals where you put out and you ask for what you want. That's where we need to start adding a sentence or two to say we want a percentage local. So Concordia now has an RFP out there. They want 75% local food in the summer months, to be fair, it's not year round. But 75% on campus will be local food. So what we're talking about is imagining Canadian tax dollars buying food from Canadian farmers for Canadian hospitals. It's crazy, crazy, crazy talk. Ryerson already has 25%, and I was impressed with Ryerson. That was the model until Concordia came up with 75. Yeah, which is fabulous. So there are 24 BC hospitals right now that have signed the Healthy Food Pledge. It's an organization, an international organization called Healthcare Without Harm, thank you. And within that, within Healthcare Without Harm, they have this Healthy Food Pledge, which includes buying local food. And 24 BC hospitals have signed on. There isn't one on Vancouver Island. My goal is to get the Comox Valley's new hospital to be the very first, because it's sustainably built and LEED certified this and LEED certified the other. So can we in fact be the very first Vancouver Island hospital that will sign the Healthy Food Care Pledge? So my inspiration is coming out of Vermont, and a lady called Kathy King. Kathy King, you won't be able to see this at the back, but she represents 11 healthcare institutions and seniors' homes. Some of them are 388 beds, some of them are as small as 19 beds. But what Kathy King did in 2006 is she took the administrators of the hospital out to a farm. And she said, wouldn't you like to be able to see the farmers and the pigs and the cows, and wouldn't you like to see where your food comes from? Exactly what Ozzy was talking about. Would you like to really know more about where your food's coming from and who is growing your food? This farm, through the association with 11 healthcare institutions, is 150 times bigger today than it was in 2006. They started that by saying, if you want us to grow that many seeds and you want the volume to ramp up that much, can you help us with the cash flow? And the organizations fronted that first level of growth and paid up front for the seeds so that they could go to scale to the next size. Oh, I won't skip over the bottom line because that is important, because everyone's going to say, how much did it cost? So it cost 2% a year is their year-over-year budget increase. That's all that they have had. So everything she's done, she's had to do within a normal cost of living increase. They managed to produce a meal for $3.65, which is US. 40% of the food is local, and they've managed to get 20% organic on a 2% cost. But that's because they cut all the multinationals out. So it's the multinational profit margins that are making local food expensive. There is an upcoming webinar if you would like to know more about institutional food purchasing and how municipalities are responding. February 25th, it's 7 a.m. I'll be speaking on that, but they don't take into account that I live in BC, so it's 10 o'clock in Ontario. Summary. Leveraging connections to transform the food system. Size does matter. You have to match supply and demand. You can't take a very small scale farmer and put them into the retail system. You have to grow together. So matching that supply to demand is not only essential, it's how you get the efficiencies. If I know exactly what I have to grow, and I know exactly what my customer needs, I can get the security of demand that I require to get the price point that is going to be competitive. Social public procurement policy is an absolute must, and we want 25% of BC food in our institutions. Now, we can do it. We can't do retail, just for the record. If we try to get 25% BC food into our retail system right now, we're nowhere close on supply. But we can do institutions. So that's the focus. Take everybody's mind off retail for a second and focus on this institutional. That's the building block between the two. We need to advocate to keep fresh food out of group purchasing contracts. Group purchasing contracts are good for buying x-ray machines and heart machines in hospitals. They're a really good idea for Canadian taxpayer getting good value for money. We do not want our food in group purchasing contracts. Island Health is the last regional health authority to be going into a massive national group purchasing contract in Vancouver called Health Pro a year from now. Unless islanders start to speak up loudly and say, we do not want food in that massive national contract. 10% of group purchasing orders should be freed up. Just don't keep me locked into 100% of all my ordering must go through the global supply chain. Free up 10% so I can buy local, especially when food's in season. Direct contracts with farmers, there's no reason why that can't be done. All of this, institutions are providing security of demand for BC farmers, and we need to get a lot more strategic about developing this market. If we did, we could have more signs around the valley, growing food for the Valley Hospital. This would be Comox Valley first, and then when you get your new hospital, why shouldn't the people in this room have direct contracts with that new hospital in a few years from now when it opens? Thank you.